case management is the link between the client and getting them back out into society. We've had a client come in and be like, hey, I need employment. I need help with some kind of source to help me obtain a job. I'm like, okay, well, sit down. We'll look on here and see what we can find that fits what you prefer. And if they're like, okay, great, or if we can't find anything, we've partnered up with Goodwill. We can send them to the RISE program. We've had clients come in and say, I need extra food.
I don't know, we're not going to be able to feed our kids this month. What are we going to do? And that's where the link to community comes in. You know, you have to be willing to go out, even on your free time, and make that connection, make that link with members, you know, in the community. And that's what we do.
I had one guy, we picked him up in a Floyd County Detention Center. He had a felony charge of assault first. He went through our program. He completed our program. He's done such a great job, and he's changed his life so much the judge is going to make a motion to expunge everything off of his record. He's building his life, and he's building it the right way, and he's building it sober.
We have case management services that we offer for Medicaid patients, and with that they're able to help them with GEDs, with transportation. If they don't have insurance, they can help them get signed up for that. They have food boxes that they can offer, gas cards to help with transportation. They're also really good about, if I have somebody that's not necessarily eligible for case management, but I say, hey, this person needs this or that, they never hesitate to jump in and see what they can find. Donations, they contact churches, anything like that that we can find the resources in this area. That's what, you know, we use case management for.
I assist individuals with employment resources, help individuals get jobs, housing, food resources. Basically, whatever that individual is calling for, you know, we've accumulated quite a few resources in the community to help them the best way possible.
If there is a copay on their insurance, which some people have it, we'll pay it for them. But we've taken Narcan to all the hotels. We've taken it to all trap houses. I mean, we just go leave it on their porches. If somebody uses it, it's worth it.
So I think that recovery is a journey and not a destination. And so for being a person in long-term recovery, I think being able to give back to my community, see other people recover, is a motivation that I get every day when I get in my car and I drive to work. It's not always easy. There's challenges. You know, we have a telephone support recovery program here, so we have a peer support that's on call 24 hours a day. We need this, and because things always don't happen Monday through Friday when the clinic's open, and so we want that person to be able to reach out to them.
Yes, we have like a case management meeting every week, and just for the whole of Journey Recovery Center. And then we also do a Baby Steps case management once a week as well. And then now that we've got that Teams thing through Microsoft, we're constantly connected with each other. But the nice thing about Teams is that you can connect about a patient and the patient care, you know, real time and come up with an answer. Like if I need somebody to get into IOP, I just, you know, text the IOP person and we got them in that week.
We work with each case manager. If I've got 10 clients that see 3 different case managers, then I talk with each of those case managers on that client's needs. And then we work together on trying to get them assistance in getting whatever it is that they need outside of here.
Here's the thing, if you're hungry, you're not gonna wanna do much of anything. You know, so I feel like basic needs, that's a necessity. That has to be met before a client is going to come in and open up to anybody. You know, those things have to be met. And, you know, that's one of the things that we do, is we're here to help them meet those basic needs.
I would strongly encourage every clinic to have a case management department, because not only is it helping other people, you're giving clients and others a second chance out into the world.
And that's what ultimately this is all about. That's why we're here. You know, we're here to give second chances. And without case management, how are these clients going to be linked to the resources they need to be productive members of society?
Sounds like it's a lot of work though.
It can be at times.
If you consider it work.
Yeah. But if you love it, then
it's not work. And we do. We truly love what we do.